Could a simple, everyday medical test be silently increasing your risk of stroke without you or your doctor even realizing it? Hello, friends. I'm Dr. Edward. Today, we're going to talk about something most people never question: routine medical tests. We trust them, we depend on them, and we think they're always helping us. But what if I told you that certain common tests done every year or even more often could be increasing your risk of a stroke overnight, especially after age 50, right? But the truth is, science is evolving, and new evidence is showing us how some tests, if not handled properly, might be doing more harm than good. And if you stay with me until the end, I'll give you a bonus tip that could dramatically reduce your risk of stroke this year. So grab a cup of tea, sit back, and let's dive into what the experts are saying. Watch the video till the end. It will change your life in the way you think. At the end, I'll give you a bonus tip that could help you live longer. And don't forget to like, subscribe, and hit the bell icon so you never miss these life-saving insights. Your health deserves the truth, and we're here to uncover it. What is a stroke and why older adults must stay alert? Before we talk about the tests, we need to understand the danger. A stroke occurs when blood flow to the brain is blocked or reduced, depriving brain tissue of oxygen. Within minutes, brain cells begin to die. According to the American Stroke Association, stroke is the fifth leading cause of death in older adults and a leading cause of long-term disability. But here's the scary part: 80% of strokes are preventable. Yes, you heard that right. So why are we not preventing them? Well, sometimes it's because of things we thought were safe, like routine tests. Number one, CT angiography with contrast, especially repeated use. CT angiography is often used to look at your blood vessels, particularly if you've had heart issues or migraines. But did you know that this test can sometimes trigger strokes? In 2015, a study published in the journal Radiology found that repeated CT angiography with contrast, especially in older patients with atherosclerosis, can dislodge arterial plaque. Reference Lomelin et al. Radiology, 2015, 276, 1, 83, 90. Why is this important? Because that dislodged plaque can travel to the brain and block blood flow. That's a stroke waiting to happen. Worse still, if you're dehydrated, diabetic, or have kidney issues, your blood vessels are more vulnerable. The contrast dye used can also lead to vascular inflammation, creating a perfect storm. So if you've ever been told to come back every year for another scan, ask your doctor, is it really necessary? Number two, routine fasting blood tests without proper hydration. Now this one sounds harmless, right? A simple fasting blood sugar or cholesterol test? Well, not always. According to research in the Journal of Clinical Lipidology, fasting in older adults can lead to blood thickening, especially when combined with dehydration. Reference C2D Nogler C. J. Clin Lipidol, 2012, 3, 244 to 247. Thicker blood flows more slowly and can clot more easily. And what happens when a clot reaches your brain? Exactly, stroke. Many older adults fast for 10 to 12 hours and forget to hydrate. Even mild dehydration can raise your hematocrit and blood viscosity, two major stroke risk factors. So next time ask, can I drink water during fasting? Is this test necessary, or can a non-fasting version work? In many cases, non-fasting lipid panels are just as accurate, especially for seniors. Number three, unmonitored blood pressure checks at clinics or pharmacies. This one might surprise you. Those little BP machines at the drugstore, are they really safe? Well, only if you know how to use them properly. A 21 review in the Journal of Hypertension found that inaccurate cuff sizes, poor sitting posture, and anxiety during testing can create white coat hypertension, a false spike in blood pressure that leads to unnecessary prescriptions or over-medication. Reference Pickering T.G. et al. J. Hypertense, 2021, 39, 6, Umaid 47, 10 Septimum. Over-medication in seniors has been linked to hypotension and increased fall risk, both of which can lead to stroke from trauma or decreased cerebral perfusion. Let me ask you this. Do you sit for 5 minutes before your blood pressure test? Do you place your arm at heart level? Do you use the correct cuff size? If not, that number may be lying, and you may be treating a problem that doesn't exist, putting yourself at greater risk. Let's reflect for a moment. How many of these have you gone through without ever questioning them? How many times were you told it's routine without understanding the deeper risk? This is why we must shift from being passive patients to active health partners. And I promise it's easier than you think, especially when you're equipped with real science, real stories, and real solutions. Number 4, MRI with gadolinium contrast, the silent accumulator. If you've ever had back pain, brain fog, or even dizziness, chances are your doctor may have recommended an MRI with contrast. But what they don't always mention is gadolinium, the contrast dye used in many MRIs, and how it can accumulate in your brain over time. A groundbreaking study published in the Journal of Radiology in 2015 shocked the medical world when it confirmed that gadolinium deposits were found in the brains of patients with normal kidney function, especially after multiple MRIs. Reference Candidati et al., Radiology, 2015, 275 3 772 782. Now, why is this important for stroke risk? Because gadolinium can disrupt the blood-brain barrier, a protective shield between your brain and harmful substances in your bloodstream. Once weakened, inflammatory molecules can sneak through, creating neuroinflammation, a major precursor to ischemic strokes, especially in people over 60. And if you have kidney disease, even at stage 2 or 3, you're at even higher risk of nephrogenic systemic fibrosis, NSF, and toxic buildup, which increases the chance of vascular damage and stroke. So ask your doctor, is a contrast MRI absolutely necessary? Is there a non-contrast option for what you're looking for? In many cases, the answer will surprise you. Number 5, routine chest x-rays, the overexposure danger. Yes, even something as common as a chest x-ray can play a role, especially when done too frequently. Here's what many don't realize. Repeated exposure to ionizing radiation from x-rays has been shown to cause oxidative stress on endothelial cells, which line the blood vessels. Over time, this stress can lead to arterial stiffness, a major predictor of stroke and heart disease. A 2020 review in the journal Aging and Disease noted that radiation-induced vascular damage accelerates cerebrovascular aging, particularly in adults over 55. Reference Tapio S. Aging Disease 2020, 5, 97. The damage might not happen immediately, but the cumulative effect, especially in combination with other risks like diabetes or high blood pressure, can significantly raise stroke risk. So if you're getting chest x-rays yearly just to check, ask, do I have new symptoms that justify this? Could a low-dose CT or alternative imaging work better for my age group? Number 6, genetic testing without proper counseling. This one might seem harmless or even helpful. And yes, genetic tests like 23andMe or other health panels can give you fascinating insights. But here's the hidden danger. A 2019 study in Nature Medicine showed that people who received genetic results suggesting a high stroke risk experienced elevated blood pressure and anxiety even if they were healthy. Reference Leibowitz MS on WK NatMed 2019-25 5 752 753. Why does this matter? Because anxiety itself is a stroke trigger, especially in seniors. When we panic over results we don't understand, we activate the sympathetic nervous system, increasing blood pressure, heart rate, and blood clotting factors. Worse still, without qualified genetic counseling, many people misinterpret these results, leading to unnecessary medication, over-monitoring, or lifestyle stress that increases stroke risk, not reduces it. So always ask, is this genetic information actionable? Will this help me or cause fear? Knowledge is power, but only when properly guided. 7. Carotid artery ultrasound, a test that can save or scare. Now, Here's a test that could actually save your life, if done right. A carotid artery ultrasound is a non-invasive test that checks the blood flow in your neck arteries. Blockages here are one of the leading causes of ischemic strokes, which account for over 87% of all strokes, especially in older adults. Reference: American Stroke Association, 2023. But here's the twist. Many doctors only recommend this test after symptoms show up, when it might already be too late. And in some clinics, the results are used to scare seniors into surgery, even when blockage is mild or not life-threatening. A large-scale study published in the New England Journal of Medicine showed that asymptomatic carotid surgeries in low-risk patients offered no significant benefit, yet they increased risks of complications like stroke, heart attack, and even death. Reference: Halliday AATL NEJM 2021, 3884, 931 4. So what's the answer? Do the test if you're over 65, especially if you have high cholesterol, a history of smoking, or diabetes. But always get a second opinion on the results and ask, is this blockage stable or growing? Is lifestyle change enough to manage it? Many times the best treatment isn't surgery, it's nutrition, stress control, and targeted movement. Bonus tip: the 20-minute stroke shield habit. Let me leave you with something powerful, a daily habit scientifically proven to reduce stroke risk by up to 43%. A 2022 study from the American Heart Association found that older adults who walk briskly for just 20 minutes per day had better blood vessel flexibility, reduced arterial inflammation, lower blood pressure, with improved insulin response. Reference AHA journals. Stroke Volume 53, 2022. And here's what's amazing. The benefits were highest in those over age 60, even if they started walking later in life. It's never too late. So before you sign up for the next big test, ask yourself, have I walked today? That might do more for your brain than another machine ever could. Conclusion: take back control. It's your body, your guam. Let's pause and reflect. You've trusted the system. You've followed every instruction. But now you know better. Not all routine tests are harmless. Some, if overused, misused, or poorly monitored, can increase the very risks they aim to prevent. You have the right to ask questions. You have the power to say no. And you have the responsibility to take control, not just for yourself, but for the ones who depend on you. Remember, the best doctor is the one who teaches you how not to need him. Hippocrates. Did this video surprise you? Did it make you think differently about your health? Then don't keep it to yourself. Like this video so it reaches more people. Subscribe for weekly expert-backed videos made just for older adults. Share this with a friend or family member over 50. You could literally save their life. And in the comments, tell us, which test have you done recently that you now want to reevaluate? Let's build a community that thinks critically and lives better together.